A few years ago, I spoke about hospitals being in transition, with one foot on the dock and one foot in the boat. Well, my friends, that ship has sailed. We're charting a path of progress that seemed impossible just a decade ago.
I think what makes Rich an exceptional leader is the fact that he is inclusive and he has a great intelligence and competence, and he picks those causes where you most need the CEO to lead. Whether the issue is healthcare enrollment or the issue is diversity in healthcare, to me, that's the shining characteristic of Rich.
His personal style just kind of puts people at ease. He's a very gentle person, be as big as he is. And once you get to know Rich, you know that you're going to sit there with him, may disagree, may have to talk about a lot of different ways to approach things, but at the end of the day, you know that his heart's in the right place.
Rich's greatest gift is his humility. Through his humility, he understands that he can't do this alone. And so he enables, empowers, and reaches out to others to invite them into the vision that he has.
His ability to move an agenda forward, to care for those individuals and the entire country, has just been incredible.
Rich has definitely been a driver in making sure that we're being bolder. In fact, bold is the word that we like to use.
Rich has always had a focus on governance. Governance because he understands that leaders of themselves must be accountable to a larger body to oversee their work and to ensure results, accountability.
The time is now. Our communities need us more than ever as healthcare safety nets and as economic cornerstones.
Rich Umbdenstock as a leader is really one of my heroes because he's been able to stand up and represent the entire country in a way that moves the delivery of healthcare forward and deals with such a diverse population.
He's always been a champion of the poor and the underserved and people who lack for insurance coverage and for quality care.
Rich is really very instrumental in putting a national spotlight on the fact that we have to provide equitable care, which is one of the aims from the IOM, and increasing diversity in healthcare management, diversity on healthcare boards, but more importantly, looking at what are the types of things like cultural competency training and things like that we need to be doing to make sure that we are embracing everyone who needs care.
Every hospital must have access to the breakthroughs being achieved in performance improvement. As a field, we must then measure and report our progress to the public. Care that is safe, timely, effective, efficient, equitable, and patient-centered. As your national advocate, you have my personal commitment that the American Hospital Association will do everything in its power to support our members in this performance improvement initiative.
I think the Hospital Engagement Network work that we're doing is probably one of the most pivotal things that the American Hospital Association has done in decades. Rich has just done a phenomenal job in helping to redirect some of the American Hospital Association's work more towards quality and outcomes, in addition to those very important roles as pertains to advocacy.
The initiatives that AHA is undertaking with hospitals in pursuit of excellence, I think just really captures the kind of vision and commitment that Rich has to changing the very nature and scope of what goes on in America's hospitals. It takes a special person to stand up in front of their colleagues from around the country and communicate that kind of message in a way that's inspiring. Not just communicating the message of the need, but communicating the impact that it'll have on literally millions of lives around the country.
Our priorities in the healthcare field are being tested. Some say we can't afford to cover millions of uninsured Americans, but we say we must.
Family is central to Rich. When it comes to understanding an issue like what does it mean not to have coverage, Rich gets it because he loves his family. He knows what insurance and health security has meant to his family. so he knows what it means and how important it is to the American family.
I can think of no one who I'd rather have leading America's hospitals and health systems than Rich Umbdenstock. He was the perfect person to lead the American Hospital Association during this era of healthcare reform. And since its passage, he has truly been effective in making sure it was implemented correctly.
Rich worked really hard with the Enroll America initiative to keep it focused, to get other people to be supportive of it, and to hold it accountable for doing those things that would be most helpful to the largest number of people in getting them the health care benefits that they were now entitled to.
Take pride in how far we've come. I wish each and every one of you the courage as you continue your own journey to excellence. Certainly there'll be choppy seas ahead, but there's nothing we can't overcome if we continue to work together. Thanks very much.
Rich is really a nice guy. Sometimes nice guys don't always finish first, but in this case, we have an individual that really can keep true to who he is, have his love for people and our country and improving the health, and actually still get the job done.
Rich is transforming the hospital into a center of health. He is a central voice in the way in which the future is being defined.
There's an Old Testament phrase that we use at the Sinai Health System and many Jewish organizations use to describe their commitment, and it's tikkun olam, which has a bunch of different translations and interpretations. My favorite happens to be repairing the universe, because it's a big, audacious idea. And I think that's what Rich represents, the ability to think in big terms and be able to drive that agenda forward.